Good afternoon and welcome to another Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, streaming on Facebook Live, and this program is also available through CTV3 in Connorsville. Our doctors, once again this week, have taken some time out of their schedule to join us. Dr. David Jetmore, Wayne County Public Health Officer. Thanks for being here.
Hi, Eric.
And Dr. Thomas Huth, Vice President of Medical Affairs at Reed Health. Gentlemen, appreciate the time once again this week. We have been taking questions already for you. I think people have gotten used to having you here. They are very glad that you're able to provide some information. So there's some things we want to talk about, some statistics that Dr. Huth, you provided. Let's start by answering a couple of questions, then we'll get into some of this conversation that we'll do eventually. So first question out of the box is, can Dr. Huth please explain a little more about how this virus can be contracted through the eyes?
Okay, that's a good question. So we talk about that the virus is really mainly an airborne and droplet spread virus. Probably where the eyes might come into it is when the virus is on surfaces, like droplets have contaminated surfaces, and you touch that surface and then touch your eyes, you're actually coming in contact possibly with the mucous membranes of your eyes. That drains down through the nose into, through a duct into the nasal cavity, and that's how the virus can possibly infect you, essentially via a complex mechanism, sequence of steps through the eyes, basically. Do you see it differently, Dr. Jetmore? You're the ear, nose, throat guy.
You know, I've heard it said that it could be contacted through the eyes. I've always thought that would be the mechanism. The tears of the eye are formed out here. They whoosh across the surface of the eye and then empty through a little duct into the nose, which is why you have to blow your nose when you cry. But I wonder if it can pass through mucous membranes as well, the mucous membranes of the eye, the inside of the eyelid. That might be another mechanism of passage. I don't think that that's been worked out. We're learning about this disease as we go along, but certainly that's the reason to wash your hands and not touch your face.
And I remember when I first sat down with you and Christine Stinson, Executive Director of the Health Department, we were having a conversation in the studio, and I have a habit of kind of putting my hands up to my face or listening and leaning on my hands, and that was one of the things, again, on television that you all decided to kind of slap my wrist about, telling me at that time that you all were really trying to keep people from touching their face as much.
We picked on you a lot that day, Eric.
Yeah, you did.
I feel bad about it in retrospect.
Somehow, I don't think
really.
so. Let's go to the next question before we get into some of the slides. We are not overloaded with COVID-19 in Wayne County, so why can't we get an appointment with our regular doctor? Dr. Huth, I think we'll kind of start with you on this one.
You know, what I can tell you is that by directive of the governor, we've, canceled all elective and delayable activities, but there are people who need to have their blood pressure managed, their diabetes managed, and we have found ways to do that mainly through telehealth means. Our number of telehealth encounters has really accelerated over this point in time. But it's true that some people need to have face-to-face visits with their doctor, and we are providing those, but we have to have extra safeguards in place to ensure that we don't accidentally bring COVID into the doctor's offices, and we have a way for those to be evaluated. But I think beginning very soon, we're going to see more normalization of services, kind of in concert with whatever the governor decides to do about relaxing the stay-at-home orders or phasing them out. And I think we're going to see a phasing kind of process, but I just don't know what that is. And we'll be opening our practices to more face-to-face business, kind of in concert with that.
And there's talk that the governor will kind of loosen things up on around May the 1st.
Okay, since we've hit that point, even before we go to these, talk a little bit about, from both of you, what you're looking for as the phased reopening begins. From a public health standpoint, what do you want to have in place? What are you hoping to be able to see? And from the hospital standpoint, where your folks are probably maybe just beginning to be able to take a breath, take a break, and you all haven't been as overwhelmed as some of the places in New York, New Jersey that we've seen. But still, I think your numbers are higher than you would like to see. What are you hoping for your folks, and what do you want to see? So, Dr. Jetmore, we'll start with you. From a public health standpoint, what do you want to have in place?
I'd like to see the number of diagnosed cases fall every day for 2 weeks. I think that would be a clear establishment of a trend. But ultimately, you know, the virus will dictate how this is opened. I think other countries are dealing with this before us because they got the coronavirus before we did. And we talked before the show. One of the gold star nations in terms of handling coronavirus was Singapore, which is a small country, but they had a lot of tests, a lot of PPE. Any plane that landed there, the people that were coming into Singapore were immediately tested. Any of their contacts were traced down. All those people were isolated. And they basically said, well, we have no coronavirus, and just told everybody to go back to what they were doing before. And now Singapore's rate of coronavirus infection is doubling every 2 days. So there's a case where they didn't gradually lift these restraints. They just said, well, everybody go about their business. Japan's had a resurgence. They apparently had this under control. China told us a week ago that there was no more coronavirus in China. Now we hear that there's an outbreak along the Chinese-Russian border. So these are cautionary tales, Eric. It tells us that we, as eager as all of us are to get rid of these restraints, we have to be very careful how we loosen these restraints. It'll have to be done in stages. Our most vulnerable population are nursing homes. Those will probably be the last areas where we are free to come and go. Someone asked me this morning, we had a meeting with the county commissioners and some of the councilmen, how long we would need face masks. Why do we keep having to buy all this PPE equipment? Mm-hmm. I think Ken Powell said they'd spent $70,000 on masks, and we're getting ready to spend another $3,000 or $4,000. And I think certainly until we have a vaccine, which will be a year, but we may be changed by this as a society. We may be, we've never been a mask-wearing society like the Chinese or the Japanese or the Koreans. That may change. We may never see a day where we don't go into a nursing home without having a mask on to visit. So that's one of the criteria, I think, is a clear demonstration that we have just a minimal or no amount of coronavirus in the environment. And then we have to be ready to jump on any recurrences. I'm sure Tom has a lot to add to this as he's...
Yeah, I mean, substantially in agreement with all that. I think the mindset that the pandemic is just going to be over on some particular day is kind of the wrong mindset. We will have COVID with us for a long time. And I think perhaps until we have, good treatment and we have vaccination, at which point it can be manageable more like influenza is. This is something that's going to be around. We'll just have to develop systems to manage while we're getting back to some normalcy in the economic realms and social realms, but managing with COVID along the way. And a lot of people are idled currently, and they need to get back to work. And people are in distress over that. I can tell you from the hospital standpoint, while we have shut down all but more or less emergency and urgent encounters and surgeries and so forth, we actually have a falling hospital census. We've got plenty of census in the hospital and plenty of capacity to do the things that people need to do. And from our point of view, what the last few weeks have been for us is a good trial run to figure out how we can take care of the COVID patients. We've gained experience and confidence that we can do that safely. And we weathered a peak that's come down somewhat, feeling very confident. Still have some issues to work out with getting enough PPE and so forth and medications, but we feel like we're in a better place than we were a few weeks ago. So for us, it's planning forward. It's a matter of how can we be able to maintain that posture, take care of those patients. If we do have a resurgence, how can we manage that, but also get back to providing normal health services when that becomes possible from a regulatory standpoint. And it's just a new normal. Things are not going to be like they were. I think it's a mistake to think that they just go back to the way they were. We will all have to learn how to get back to a normal life, but with COVID around, and what safeguards we're going to take to make sure that we're safeguarding ourselves and others along the way.
Neither of you in that mentioned testing. Can we begin a phased reopening before we know who has it or who had it or who's asymptomatic? So do we not have to be able to seriously in Wayne County, and I'm speaking locally, ramp up what is testing? Because if you look at the numbers from the state has yet to test the number of residents throughout the entire state of Indiana that we have here in Wayne County. So,
right.
But that's a national problem also. How do we face that? How do we tell everybody, okay, we took you down, we sent you home, and now we're going to send you back out there with virtually no more information than you had when we shut you down?
Well, that's what's crippled us during this epidemic, the lack of testing. We've only been able to test the very sickest patients, and the tough part of dealing with this disease is that many of the patients have no symptoms at all, or they don't have symptoms for a period of 5 to 10 days, and they're shedding virus everywhere.
When you say shedding virus, I almost envision little mites or something running off of somebody's hand. Talk about, when you say shedding virus, what it is that you're speaking of.
The cough, or even some people talk about an aerosol spray. If you're sitting next to somebody that's eating garlic for lunch and you can smell his breath, you're smelling the aerosol from as he exhales from his lungs. Some people think that aerosols of the breath can also contain virus particles. But the person's hands are contaminated, so everything he touches, a banister or he's touched the infected person's touched his eyes, rubbed his face, his nose, so his hands are. That's why we ask that all these commonly touched surfaces be disinfected, because they're going to have virus particles on them. But back to the whole testing thing, and I'm sure Tom will have a lot to add to this. From a public health standpoint, when somebody has a disease that's highly infectious, you test all of his contacts or her contacts, and then you isolate those people, and then you would test their contacts. Well, we haven't had the ability to do that. For number one, the tests have been very scarce. And number two, the turnaround for the tests takes a long time. And of course, 24 hours in terms of the movement of people, that has a real effect. I think we're working on and do not have yet a real reliable antibody test. And what this would do would be a person would have a blood stick. The person's blood would be analyzed for antibodies. And this would tell us, in some cases, one of the antibodies, there are 5, immunoglobulin M or IgM would go up initially when you have the infection. But more importantly, from the standpoint of getting out of this, unlocking this lockdown we're in, it would tell us who's had this virus. We're going to find a lot of people that had no symptoms whatsoever. They didn't know they had coronavirus, and yet we can tell from doing a blood test that indeed they did have coronavirus. We can tell from the antibodies. Those tests are preliminary available, but I've heard epidemiologists say that they're not reliable enough yet to be used in really the fashion we need. In an ideal world, everybody in America would get tested, but we just simply don't have the test to do that.
And testing definitely been a big gap in this whole thing, and fortunately, we do see that that's going to change. It's just not changing fast enough for any of us. The ability to do the current PCR-based test, the test for the genetic material of actively replicating virus, tells something, but it doesn't tell the whole story. So that plus antibody testing, I think, is kind of the complete package from a testing standpoint. But there are still a lot of unknowns, even when we have more, very plentiful PCR testing, and if we have very plentiful antibody testing, we don't know for sure that the antibodies that are produced are protective, as an example. We're making an assumption that if I have an antibody test and we see that I've got lots of IgG or IgA, that maybe I'm immune, but we don't know that for sure yet. It just hasn't been studied.
Or if we are immune, how long will that immunity last?
Exactly. So I think having more plentiful testing will give us a lot of confidence about exactly what we're dealing with, and hopefully will be helpful in helping us identify people who aren't at much risk of getting active disease again, assuming they had it once already. But those are question marks that are still to be worked out. So yes, we need the testing, but I think the reality is we don't really have it that plentiful today. I've got more now than I had last week, and which I had more last week than I had the week before. But we're still not plentiful enough to be able to just test everybody, which would be nice to do. We're not there yet, but I think that's going to change. In the next few weeks, we'll see a lot more availability come about. But testing's part of the answer. It's not the whole answer. And I'm not sure that will remove the likelihood that we're always going to have COVID in the picture. We just have to figure out how to operate effectively and safely in spite of it.
You're watching Ask the Doctors. Dr. Thomas Huth from Reed Health, Dr. David Jetmore, Wayne County Health Department. There was a question that came in that kind of touched on this. Will the ability to test those who probably have COVID-19 ever be possible? I guess ever being, you could almost say sure at some point, huh?
Right. I guess I'm not sure what we mean by probably exactly. We can do the PCR test now that if you're positive on that, you almost assuredly do have COVID now because the specificity on that is pretty high. Which simply means if you have a positive test, the likelihood of that being a true positive is very high. It's in the 95+% range, I think. So that's probably right now, the only test that's kind of like the for sure thing. The antibody test later on, as long as the antibodies, an issue with antibody tests is sometimes antibodies may be present that may indicate, say, COVID exposure, but sometimes antibodies aren't that specific. So, I have a feeling that some of the early phase antibody tests will probably be able to say with a probability that this is specific for the coronavirus that causes COVID-19. There are other coronaviruses, though, that are commonly in circulation. So it may only be a probability. Maybe there's some cross-reactivity, I guess is what I'm saying. We don't know these things yet, so we'll have to see what the tests are that emerge and what their, in testing terms, what we call their sensitivity and specificity It's particularly the specificity number needs to be very high to have a lot of confidence that the presence of those antibodies is specific for the SARS-CoV-2 that causes COVID-19. So those are questions yet to be determined. And so I guess from thinking about it in those terms, you could say that's a probable question. If we have a sort of first-generation antibody tests that only give us a probability of it being COVID-19, but a smaller probability that it could be one of the other coronaviruses that it's detecting, then you'll be in this probable state. What we would like to be, though, is in a level of high degree of certainty that when we detect those antibodies, that means you had SARS-CoV at one time.
Well, I agree with Tom. I don't think the antibody test is going to displace the test where we're actually swabbing the nasopharynx. You actually have the virus on that swab, and you're able to replicate that viral RNA enough that a machine can detect it. It's duplicated over and over again, sometimes, believe it or not, 1 billion times in a couple hours. So I think probably the two tests together, Tom, will probably.
Yeah.
But the answer to the viewer's question is yes, we can. If we see somebody that has probably has COVID-19, we can test them and ascertain that.
One of the things that you brought up is when I asked what you want to see, you said you want to see cases come down over a 2-week period. One of the questions that have been asked repeatedly is, what is the patient count at Reed Health for COVID-19 patients? I think you provided kind of some charts that I'd like you to go through. Okay. Ryan's going to bring those up. The first one I think is COVID-19 IP trend chart. So if you can tell us what the lines are that we're looking at.
Right, so there's a lot going on here. It's a little bit busy, but this is a trend chart in inpatient COVID known or suspected patients in the hospital over time. And probably the thing to focus on is really just the height of the stacked bar charts, not all the other lines and so forth that are elsewise in there.
And it's hard to read, but those are dates across the
right,
bottom.
Across the bottom. And basically what that's showing is that we had kind of a plateau or a peaking between about April the 1st and April the 7th or so, where we had the most patients in the hospital of all types, whether they're in the ICU or on other wards, whether they're on ventilators, and all that information is contained in the chart. But we topped out in the 63 to 64 patient range between those dates, April 1st to 7th. Since the 7th, we've actually been on a bit of a downtrend. You can see that we stepped down to about the 11th or so, and then we've been kind of plateaued in the 40 to say 43 or 44 patient range since that time. So we're past a peak. Now, is it the peak? I don't know right now. Maybe we'll have another bump, and especially if we have loosening of the movement restrictions and resumption of business activities, maybe we'll see another peak. But I think what our position is that that gave us a good test of our systems. We built a lot of systems. We kind of figured out what works and what doesn't work, how to provide for safety of staff, and we're confident that we can manage at least back to that 65 range, if not higher, should we experience that again.
One of the other things that has been asked, and I think you said you were asked on a call earlier today, actually, was the testing by county, and we've marveled at the fact, actually, that some of the numbers in Wayne County have been lower than some of the other counties around us. So another chart that you provided was COVID testing by county. I think that you all have not done all of these, or have you?
Well, yes. What we're seeing here are all the tests that were processed through Reed.
Okay.
So that's not everybody in the counties who got tested. There are other ways people can get tested. So the question this morning to us was, the majority of the positive cases have been in counties outside of Wayne County. I think the Wayne County count is is
22.
22, but it's much lower than some of the surrounding counties that we have been interacting with, that we've taken care of those patients. So the question to me this morning was, does that mean we've only been testing people from those other counties and not testing as many Wayne County folks? But so I asked one of my tech gurus to say, hey, can you map by county where all our testing has been done? This is positives, negatives, inconclusives, still pending, everything that we've done. And you can see that actually the majority, the lion's share of our testing has been on Wayne County residents. It's just that we're not finding positive cases as frequently among the Wayne County folks as in people who live in other counties.
Do we have a reason? Do we know why, even though we're doing, and the number was 193 tests here in Wayne County, that we're not finding it? Are we that good? Are we that lucky?
We're that good, Eric.
Okay.
There's that. We are that good.
You know, the answer to that
there are other
question
reasons.
is we don't know. That's the real answer. But I like to think that it's due to the citizens of Wayne County. You know, the only tool we've had to combat this disease is social distancing, washing your hands, and avoiding contaminated surfaces, which is a pretty blunt weapon. But I didn't make those numbers happen as a health officer. The doctors didn't make it happen. It's the people in this county that made it happen. I think they took these directives from the health department and the city leaders and took them seriously and distanced themselves and stayed home. And that's what I attribute it to. But, you know, it's funny. An epidemic is like a force of nature sweeping through. It's like a hurricane. You know, you don't know what happened in the hurricane until it's gone, and then you assess the damage. I think we're going to find out what happened long after the epidemic is over with. We're going to be doing antibody testing and analyzing why these things happened, what worked and what didn't work. And there may be many answers or questions that are never answered, but we're kind of in the middle of the hurricane right now, and we just have to kind of guess at the answers.
I'm sure that the steps that the county health department folks have taken, the county leaders have taken, have been helpful in reducing the numbers. But I think it is a multifactorial thing, and I still think there's some geographic aspects to this. In our service area, in Reed's service area, the Fayette County and Franklin County particularly have been hard hit, and that's where a lot of our positive tests have come from. And I think there are some reasons for their counties being hard hit that are related to Fayette County's contiguity with Franklin County, and Franklin County's contiguity with some other hotspot counties in the state. So I think there's maybe some bleed over, people traveling between them or working in one and living in the other.
Timing may be a factor. That, if you got the coronavirus early before, people really were able to respond to it, then and that may have happened in the Franklin County case. They may simply have, the virus may have arrived really before people were ready for it, because I think that Franklin County case was the first case we saw at Reed Hospital.
That's right.
You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, streaming on Facebook Live. This is also available on CTV3 in Connorsville. We need to get back to more of your questions for the doctors. So next one up, when a patient needs hospital care for COVID-19, how long do they tend to be in the hospital?
It's widely variable. We've had some stay as few as just a couple or 3 days. They weren't that sick and got better quickly and were able to go home. But typically, though, the ones who get very sick that require to be intubated and placed on a ventilator, they will often be hospitalized for 2 weeks or more before they're able finally to be weaned. And we've had several cases where even that wasn't possible, and they had to have tracheostomies, and we have a couple of those cases in the hospital right now. So those are very sad, but it just points out all the widely variable nature of this disease. I mean, we think that as many as 25% of people who become infected with it really never show any significant symptoms. Yet they are able to shed virus and transmit the disease to others, and that can go on for a prolonged period of time, which is a part of the difficulty in fighting this. But then there are other people at the other end of the spectrum who get very sick very quickly and even pass away. Typically they are much older. It's the older demographics, oldest demographics, and they typically have multiple other chronic diseases. In the national statistics and the statistics from China and elsewhere, it's the combination of age plus diabetes plus heart disease are sort of the big 3 risk factors, but other chronic diseases in the picture are an issue as well. So we see a broad spectrum of illness, and really the majority of people don't need to be in the hospital at all. So I think if you took the average days in hospital for all coronavirus patients, it would be, a tenth of a day, because the vast majority of people never really need hospital care. But then you have the relative few who have very prolonged courses. So there's not one answer, one number about hospital length of stay and the things that are needed. There's not really one answer to that. It's very, very dependent on a variety of factors.
Let's keep going with a few more questions. I know they've been coming in. With so many tests being administered, how will we know that the numbers are coming down? I know of people who were presumed positive but were not tested due to being symptomatic.
Well, this is a great question for Dr. Jemmer, but I'm going to interject beforehand that I had a conversation earlier today about, the testing. As more testing becomes available, we want to test more and more people. That means we're going to find more and more cases, particularly low symptomatic and asymptomatic cases. And so I wonder if this idea that we need to see a declining number of new cases somehow needs to be adjusted for the number of tests that are being administered. You know what I'm saying? That, because right now we're in a state where we're still only testing the sickest people, and we're going to find a high number of positives among them. And as this question indicates, we do have a large number of individuals. We think as many as about 40 to 50% of people who come through our respiratory clinic are at least moderately probable of having COVID, but they don't qualify for our testing because they're not sick enough. But they're given information about self-care and self-quarantine and so forth. And so there are now a significant number of people who've been told, we think you have COVID, but we're not going to test you, and here's what you need to do. So people are becoming aware of that. But I think over time we're going to have more ability to test everybody, and even test people who are asymptomatic. And we're going to find a lot of cases that way, which I think would be a good thing. But we'll have to maybe readjust our metrics for what constitutes kind of getting, being on the downslope and being able to pull back some of the restrictions that are in place as a consequence.
I think one of the things that's interesting, Tom, is you can sort of project the amount of people infected from the mortality. Mm-hmm. The more mortality from the disease is thought to be 1% or maybe 1.1%, which is significant. I mean, that's 10 times the mortality from influenza. But when you look at areas like England, Spain, Italy, they're reporting mortalities of 3 and 4%. Well, that tells you that the more people they test, the more coronavirus they find, the lower that mortality number will get. So that's kind of a prediction of how much disease is out there. I'm not sure at this point what the viewer's question was about testing, but certainly as we do more testing, we'll find more and more positive cases.
Getting some help today from WCTV staff. Ryan Harris, who's our director, has been every week. Michelle Thompson also kind of helping keep the questions flowing, so let's keep going. Our daughter works in healthcare, was off 14 days, presumed positive for the virus. Can we assume she's immune? And resume visits with her. My husband and I are both 80 and have underlying conditions. I'm not going to point to anybody. Whoever wants to.
Well, I think there's probably sort of a guidance answer to this, and there's sort of a scientific, strictly scientifically answered basis to this, and they coincide, obviously. But I think from more of a scientific point of view, the reality is that most people, certainly by 14 days after the onset of illness, are usually deemed to be, virus-free, and their own quarantine can be ended and so forth. Now, I don't think that means that the 80-year-old parents should relax their own posture. They need to make sure they're using good distancing, sanitization, and so forth. And maybe their daughter should still use a mask around them. That's probably what I would recommend. But I know that the current ISDH standards for, like, say, return to work after actually having COVID is either a minimum of 7 days and having 2 negative tests at least 24 hours apart, or being fever-free without the use of Tylenol for 3 days, and 7 days after, at least 7 days after the onset of symptoms, whichever's longer. So like if on day 6 of illness, that's when my fever goes away, then I'm going to be out another 3 days at least for that fever to be certain to be gone. And so in that case, I could potentially return to work, somewhere between 7 and probably 10 days after the onset of illness. But even then, the State Department of Health recommends that I should still wear a mask and practice distancing, and if I can work from home, I should do that preferentially, and so forth. So in a case like this, 14 days after, basically the daughter has gone through the standard quarantine period, and I would think that it's okay for the parents to resume, contact, but they should all still take precautions. What do you think, Dave?
Well, we've had to use these criteria because we haven't. I would love to have the luxury of having 2 negative tests 24 hours apart,
Right.
But it's been so hard to get these tests. And we've sent people home with presumed COVID-19, and they're wanting to know when they can go back to work. So I've used those criteria. 3 days without symptoms or a fever, and 7 days after the onset of the disease. But I agree with Tom. I think you should probably still protect others from. I'd probably wear a mask and be careful of what you touch.
Mm-hmm.
Dr. David Jetmore, Wayne County Public Health Officer. Dr. Thomas Huth, Vice President, Medical Affairs, Reed Health. You're watching Ask the Doctors on WCTV Channel 11, WCTV Channel 21, also on Facebook Live. We've got more of your questions for them. Next up, I ordered a knee support online and prepaid, and it's being shipped from China, which I wasn't aware of. I wasn't aware of this until the order was completed. What should I do? Do I need to be concerned upon arrival?
I don't think you need to be concerned. I think you can put that knee support right on, and the reason I say that is for 2 reasons. Number one, many of these things are packaged in China by machines, and the second case is how long the virus lives outside the body. On cardboard surfaces, it is said to live for 24 hours. So on its journey from China it would have that time would have elapsed. It's supposed to maybe live on plastic surfaces for 72 hours or more. So if you were concerned, you could wipe the package down with a disinfectant. But I wouldn't be too spooked about getting a knee brace from China.
Okay. Next up. If not already being discussed, please start sharing recommendations for summer programs. This kind of got touched on last week, but as the weeks go on, people will want to know. Both those employed by and parents who need programs for child care need to plan for changes in programs. Will the city pool open? JUCO, Boys and Girls Club, will they be available this summer? Summer camp programs, any thoughts about canceling Richmond's summer programs? Fireworks, can they get supplies to operate? I know Anderson is a community, I believe, that has already canceled their 4th of July celebration. IU East has announced that they're canceling their annual Run with the Wolves 5K, which was scheduled for mid-July. So people are beginning to think out, and I know they're looking for some recommendations for that. I think last week it was a baseball program maybe around Centerville, where I think the kids would start practicing in May but playing in June. Where do people need to go? We're talking about reopening parts of things in May 1. Will gatherings of large people be allowed?
Well, as you were saying about the 4th of July, the Wayne County's canceled their 4-H fair.
Correct.
They've held that 4-H fair for 100 years, and that's in mid-July, or maybe the second week of July, but it's out there. I think, and this is going to frustrate the questioner, I don't think we know the answer to these questions, and I think it will become clearer as time passes. I think some of these things that are a couple months out, June, July, August, I don't think these should be canceled, or we're just going to assume that they're not going to happen out of hand. But in truth, many of these activities will either be canceled or may not reopen during that time. As we said earlier in the show, so much of this is dependent on the level of virus in our society, and we'll be able to tell that with further testing, numbers of hospitalized patients. We're just going to have to wait and see. I know that's frustrating because I know these parents of these little kids want to see them go somewhere, not only for the child's good, but after spending time with grandchildren, I'm always happy to see them revisit their parents. But we'll just have to wait and see, Eric, to see how this all unfolds.
Do you, either of you, see a point this summer, truly, where we could put 100 kids together, with some of them playing baseball, being in a dugout? You're talking about social distancing probably still being a part of this. It's hard to social distance when the dugout is only 6 feet long and you've got 15 kids in there, and I don't know exactly what those numbers are. But I think that's what people are looking at. I don't know that they're thinking about hard and fast, but based on what it is you're recommending, can you really see those kind of numbers on mass gatherings like that? I know the PGA is talking about starting up again. That's 2-3 guys, and they can walk, but there'll be no spectators. They can walk 6 feet apart if they need to, but when you're doing contact sports, will football players be able to begin practicing in June or July that close to each other?
It's hard to see that at this point, Eric, quite honestly, but I'm hopeful that some of these areas will open up. But it's hard for me to imagine at this time going to a baseball game and sitting in a crowd of thousands of people. I've been traumatized by what we've gone through. We'll get there again. We'll get there. Life will return to normal. It's just so hard to see that far out. And you saw Dr. Hughes looking at that that peak at the hospital. It's at a plateau right now. Will it go up? Will it go down? Will it stay level for a while? We just don't know. I wish we could give a better answer to these parents.
It's hard to add much to that, but I guess maybe a different way of saying it is a lot would have to be different than we have today. If July looked exactly like today in terms of availability of tests, viable treatments and rates of infection and fatality rates and everything like that, if everything were the same in July as they are today, it's hard to see being able to achieve that level of openness by then. There would have to be a really credible plan for how you're going to manage the distancing and sanitization and infection control aspects of things. But maybe things will be very different by July. Maybe suddenly someone will discover a really effective antiviral medication, and we get to that point that I described earlier where it's a little bit more like treating influenza. We've got, we don't stop everything during influenza season. We have treatments. We know how to get people through it. Yes, there's a fatality rate, but it's a more manageable one than the coronavirus rates are currently. So a lot will have to be different, I think, and it's just maybe a little bit hard to imagine it's going to be that different, 3 months from now. But I could be wrong. I hope I'm wrong. Because I would like to see things get back to absolute normalcy as quickly as they possibly can. What we have to have is a sense of balance. How do we achieve more, stepwise normalcy in life, particularly when it comes to economic life, people back to work and factories working and so forth, without overwhelming the healthcare system and without putting individuals at disproportionate risk, like the elderly and infirm and so forth. So a lot of things have to be balanced in there for that to work.
I think we've got more questions. The voice in my head says, this morning's state dashboard update shows a second COVID-19 related death in Wayne County. Can you please provide any information about whether that patient was hospitalized or at home, age range? I'm not sure what you're able to say about that.
It was not a hospital-related death. That's all I can tell you. I don't know a whole lot besides that. Dr. Jetmore may know.
I think, of course, we're always cautious about revealing too much about these patients. We want to maintain their identity, but this person was in their late 80s and died outside the hospital.
Okay. We've got 10 minutes left in this week's Ask the Doctors. The doctors will be back next Friday, as we do this live every Friday at 2 p.m. here on WGTV Channel 11, WCTV Channel 21, streaming on Facebook Live, also CTV3 in Connorsville. Let's see what the next question is. Are community agencies able to get cleaning supplies, hand sanitizer, masks, etc., any easier yet? Will the ability to get supplies be included in decisions to reopen? And they're also asking about nursing homes, hospitals, etc. So what can you all provide as far as, particularly Dr. Jetmore, any information? And particularly the last question, will the ability to be able to get supplies be included in a decision to reopen, so that as people are going into their offices, into their businesses, if we're saying we're reopening the economy, how can we keep them safe? There's a lot of hard surfaces there that you want to be able to wipe down.
Well, as I said earlier in the program, the county commissioners ordered, I think, $10,000 worth of masks, and those were just for city employees. They've been used up. So that was a conversation in today's meeting about getting these supplies. So there is a shortage of supplies, but having said that, I think this is a much more solvable problem than trying to get ventilators and tests, immunoglobulin tests and more viral tests. I think that everybody in America that can make a mask or make gloves is cranking them out. So I think this is a problem right now, but I think it's a problem for the short term. I think as we get out, this will quickly be ramped up, and we'll have more personal protective equipment. What do you think, Tom?
I agree with that completely. It's a little bit less constrained, sequentially over time. There are still limitations on what we can obtain from a personal protective equipment standpoint and sanitizer availability, but it's not so bad as it was, and I think that over time we're going to see a lot more supply be available that's made in the country and doesn't have to be shipped from foreign sources as much, and so I think that's going to be an improvement, one of those things that will improve, in the foreseeable future.
Is the ability to get more PPE for people working in hospitals, the doctors, nurses, is that a criteria for being able to open? It's not as bad here, but it is obviously in some of the urban areas.
Yeah, and even in our own community here, the nursing homes are a lot more constrained on their supplies of PPE and so forth. So right now Reed is in pretty good shape, but we need to have those supply lines open up further. And it's more acute for some portions of the healthcare system outside the hospital. So I would think that, the ability to ramp up and care for more patients in the healthcare system would logically be one of the criteria for being able to resume other other parts of the economy in a more rapid fashion. But that's all kind of above my pay grade, but I'm sure it's one of the many factors that the governor and others, and locally the county council and the city council and the health department with Dr. Jetmore and Christine Stinson's leadership are kind of wrestling with. It's a complex question: how much do you open and when, but I'm sure that's a part of the equation.
The federal supply of this has been diverted to hotspot areas, places like New York City, Detroit, New Orleans, and as these areas come under control, I think we'll see more than our share we've been getting flow into this area. So I think we'll be okay on that score.
I think we have a question that maybe is trying to go into a little bit more detail about the reopening. That seems to be the conversation that has been really leading over the last few days. I'm going to let you all read it. I'm not going to try to read everything that's there. Obviously, they're talking about the president's plan for a phased-in opening of the economy. I'm pleased the decision-making power is in the hands of the governors, collaboratively with regional partners, and I think as much as we travel, that's important. That being said, I'm confused about how we are counting COVID-19 patients in Wayne County. Are all patients counted in the publicly reported numbers to include tested and presumptive, or do we only count those that have been tested? I'll let you, Dr. Huth, I think, go into some of that as it flips a little bit.
Well, in the state reporting that you can see on their heat map on the state's website devoted to this, they count only positive tests. And we don't think that's even they don't think that's a really accurate, truly accurate representation of the situation, but it's the hardest data that they've got. When you look at the Reed website and on our Plan Don't Panic portion of our website, we provide some statistics from Reed's perspective, and we include information on the numbers of patients who are being tested, how many are positive, how many are presumed positive based on symptoms and so forth, how many we're evaluating, because that gives a little bit fuller picture. But the problem is you get all these different data sources, and which one is the right one, and it depends on exactly what you want to know. But all I can tell you is we think that probably 50% of the people who come through our respiratory clinic And, you know, like I think yesterday we saw 70 people, and it's been typically in the 40 to 70 a day range. Up to 50% of people come through, we think probably have it. Only a small minority of those are sick enough to really need to qualify for testing according to our standards. And so that we're only testing a small portion of that. But we also know that we probably only, you could look at it another way, all of we're only testing about 20%, this is state information, testing about 20% of people who probably actually have the disease. So whatever numbers we have for positive tests, you can probably multiply by 5 as a general estimate of what the actual prevalence of the disease in the community is. So we've got 20-some tests positive now. That means they're probably really closer to 100 or maybe more just in Wayne County who probably actually have the disease. So there are different ways you can kind of work into estimates of this, but it's really hard to get an accurate number without having more expansive testing.
It all comes back to testing, Eric. I think Tom's exactly right. I think nobody knows what the multiple is. And like I said earlier, we're not going to really know these numbers until probably the epidemic's over and we can walk through the aftermath and scratch our heads and try to discover what happened. But certainly there's many more cases out there. I know of people who I'm sure had coronavirus and recovered at home. They were never tested and they were not included in these numbers.
Mm-hmm. Now, in Ohio, I will say, Eric, the Ohio Department of Health has required their health departments to not only report positive tests, but report people who have probable coronavirus, and that's according to clinical criteria. And they are now wrapping those numbers into their total cases. So Ohio is taking a different approach than Indiana, which means you can't compare Ohio and Indiana's numbers exactly. You know, they are including some things that Indiana doesn't. And I don't know whether Indiana will take this approach or not. They haven't said so far, but this is a recent change from the Ohio Department of Health standpoint, which we're trying to help with because we see a certain number of Ohio patients, and so we have to provide information on these probables.
Okay, gentlemen, we have come through another hour. So I want to thank Dr. Thomas Huth, Vice President of Medical Affairs for Reed Health, Dr. David Jetmore, Public Health Officer, Wayne County Health Department. Thank you both once again very much. We'll see you both again here next Tuesday at 2 p.m. as we answer questions.
Friday.
Thank you for watching this week's Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21. Thanks for watching. I hope you have a safe weekend. Stay home. I wish you well. God bless.
It's a personal policing. It's a personal responsibility. It's being in close proximity to others that increases the spread, or touching flat surfaces and then not washing your hands and touching your face. These are the issues. That is really, really hard to police. Is what will keep the spread from happening rapidly, which will spike the healthcare system and make it hard to treat people. You as a citizen have a responsibility to take this very serious because human lives are at stake.